Well, good morning, or good afternoon, everyone. Welcome to another session of the 17th annual Transforming the Teaching and Learning Environment virtual conference. I'm Bob Hales. I'm the moderator. I should say Happy Valentine's Day, and it's also National Ferris Wheel Day. I suppose you could merge the two, though most places it's going to be kind of cold on a Ferris wheel. We have with us Tracy George, an associate professor of nursing and the J.L. Mason Endowed Chair in Health Sciences. Woohoo! And the coordinator of the Bachelor of General Studies program at Francis Marion University. We also have Sarah Kirshner, who's an associate professor of public health and chair of the Healthcare Administration Department, also at Francis Marion. And not here is Claire de Cristofaro, and who's an MD. And is she teaching regularly now?
She's still teaching with Medical University of South Carolina, yes, in Charleston.
Okay. Oh, yeah. If I read the last line, that's what. Anyway, they're going to talk about students' perception of digital resources for patient education. I turn it over to you all.
Okay, great. Thank you so much for that introduction, Bob. And it's great to be here today with you all, and happy Valentine's Day to each of you. So, we're going to be talking about health literacy today. And over the years, I've gotten really interested in health literacy and worked with Sarah and Dr. DeCristofaro on several projects. We're going to be talking about health literacy as well as digital health literacy and how I have incorporated the digital health literacy into the curriculum for a course and the survey results. So, what is health literacy? And, sometimes we think about literacy as just whether someone is able to read or write, but health literacy is actually the degree to which patients or individuals have the ability to find and use information and services to make health related decisions for themselves or their families. And sometimes patients who even have college educations have difficulty with health literacy. And one reason I've been interested in this, I do geriatric home visits, and it's amazing how many unnecessary ER visits, hospitalizations are due to health literacy. Patients get confused. They don't realize that they're taking the same medication from two different providers. They don't understand the directions. They don't realize that they need to follow up. Many of the patients in our area of the PD region of South Carolina only read about the fifth to sixth grade reading level. So that makes it even worse. So, anyway, we're going to be talking about that today. And health literacy is so important related to health and health outcomes. So, about half of Americans have issues with low health literacy. And that's a huge issue that is really not recognized as much as it really should be. What about our older adults? And older adults are some of the sickest patients that we have. A lot of times they have many chronic illnesses, complicated medication regimens, need for follow-up, and it's just really a challenging population. It's the fastest growing segment of the population is seniors who are 65 years and older. And we have to think about both the patient and their caregivers. So, having better health literacy is important for us to have better outcomes with our seniors. And it's legal end of life issues, financial issues, medical issues, in home care, housing. So it's a lot of different things that go into those needs of older adults and health literacy. So, what about us as healthcare professionals? I teach in nursing and the nurse practitioner program. Um, So we know that patients who are engaged in their health care and partner with their healthcare provider do have better outcomes, and they're better able to manage their own healthcare needs. We as healthcare providers can support better outcomes and improve decision making. And healthcare providers, that includes nurses, physicians, dentists, pharmacists, therapists, public health workers, social workers, counselors. So, it's not just nursing. So, what are the components of health literacy related to patient education? Finding and interpreting health information so that patients can make decisions is important, and those decisions that align with their preferences, and also finding available health services. And we sometimes take that for granted, but that can be a huge barrier for patients. When I'm doing the home visits, a lot of times, finding resources, looking up phone numbers, finding websites, this is really truly a challenge for especially our senior population. Now, we've talked about health literacy, but what specifically is digital health literacy, or e-health? And digital health literacy is defined as the ability to seek, find, understand, and appraise health information from electronic sources and apply that knowledge to solving a health problem. That's from the World Health Organization. And we know that websites are used very extensively. Also, apps. How many times do you go to your doctor's office and they talk about the portal, the app, messaging, looking up your results? And that's, again, part of that digital health literacy. Also, social media sites and online videos like specific YouTubes or educational videos. And all of this is, becoming very standard practice in the American healthcare system, is looking up these online resources, especially websites and the portals that are associated with the electronic medical record. So as educators, we need to introduce our students to this, and health information technology includes the use of electronic devices and systems such as electronic medical records. And including health literacy content can help our students' awareness, knowledge, and skills about health literacy, so that students are able to provide care that is appropriate to patients who do struggle with health literacy. So the internet, about 8 million Americans use the internet daily to research health-related topics. Just yesterday I had a patient who was talking about her research into a certain topic. How many times do patients come in and they've already researched treatments or things about what they think is wrong with them or their diagnosis? And patients with chronic disease are more likely to obtain information from websites. And some of that is just information seeking. They want to know more about their diabetes or COPD or their coronary artery disease. We know, though, that not every website is reliable. And as healthcare providers, that's something that we are aware of. But sometimes patients don't know the difference between what's reliable and what's unreliable. And it's amazing some of the information that patients can find that is not at all evidence-based, and they may even purchase devices or supplements that even could be harmful to them. Another thing that many times we as healthcare providers and our students aren't aware of is that the average readability of some patient education websites is at the 10th grade level, which it's recommended that patient education materials be at the 6th grade reading level. So some of these patient education websites that people use quite a bit are going to be difficult for many patients to really understand. Now, what do we mean by the digital divide? So some patients in the U.S. are being left behind because they are not able to use the internet and apps. And that's what we mean by a digital divide. And this is a little bit of an older study, but Levy et al. Found that only about 9.7% of older adult patients with low health literacy use the internet to obtain health information. My mother is 87 and she really has no idea how to use the internet. So the percentage may be a little bit higher now, but I still think there's a good segment of our older adult population who are not sure about the internet, portals, apps, YouTube, all of that. Before, the digital divide was more of a disparity in access, not having the internet. Now it's more of an issue related to skills and searching for and using health information. Again, using my mother as an example, she does have the internet at her house, and she uses it like for her TV to be able to watch TV, but she doesn't know how to search information related to her health. And some of the strategies to incorporate e-health learning into the healthcare curriculum includes toolkits and different learning activities. And we'll be talking about a learning activity that I incorporated in a little bit. And we know that students routinely use the internet to search for healthcare information. Nowadays, if you go into college libraries, there are fewer and fewer books because so much is on the internet or through other electronic databases. The ability to do internet searches is not information literacy. Information literacy is the ability to access and determine the information needed, apply a critical analysis to the information and its sources. Student education about digital resources can also support patient education on digital health literacy. So things such as patient portals, self-check-in kiosks. How many of you have seen patients who really struggle at the ER, family practices? They can't figure out how to do the self-check-ins. Knowing the value of these resources, and learning more about healthcare mobile applications and devices. So to meet the goals of Healthy People 2030, we need to integrate digital health literacy into our healthcare curricula. And student learning activities that promote awareness and competence in digital health literacy are recommended. Some of the goals include supporting patient education proficiency, the patient's ability to read, understand, and apply health-related information, and also find and evaluate resources, both traditional and digital resources. And the purpose of our project is to assess graduate nursing students' perceptions of the role of digital resources in patient education. And so it's important for us as educators to create these learning activities that do promote awareness and competency in this digital health literacy. It's not enough to have them to read an article. Really digging in is very eye-opening to the students. I teach a graduate nursing course called Patient Education and Advocacy. It's required for all graduate nursing students who are in the both psych mental health nurse practitioner and family nurse practitioner program. So everyone who goes through this course, they analyze healthcare patient education websites for both readability, design, layout, cultural sensitivity, and appropriateness. And I've gotten feedback over the years that this has been a very valuable activity for them. So now I'm going to turn this over to Sarah, who will talk about our study design and results.
Hey, thank you, Tracy. So one thing that we found too going into this was many of the nursing students tended to overestimate the general kind of reading level of the general population. And so again, I think this activity, and we've done it over the years now, is one that's really important because it seems that nursing students will overestimate the health literacy level of the patients and the families that they're serving. And so this tends to kind of put things in a very realistic perspective. The students were family nurse practitioner students enrolled in our patient education and advocacy course. Demographic information and survey data were obtained to assess the digital health literacy and students' perceptions of the role of digital resources in patient education before and after they analyzed healthcare websites for digital health literacy. We did receive permission to use the survey, and we adapted it, the eHeal survey that was developed by Norman and Skinner in 2006. And then we added 5 qualitative questions to the assessment. And we obtained IRB approval from our university's IRB. Hold on. Do I have control of the screen here? Oh, there we go. Okay, thank you, Bob. So the learning activity, there were 5, and this is the first one, and it was to evaluate the web resources for readability. And so patient education information should be no higher than the 6th to 7th grade reading level. And in South Carolina, there's actually areas, and I'm sure there are areas in other states where that reading level is even lower than that. And so we really have to take that into consideration when we're working with our patients and families. Research shows that web-based education materials often are at the 10th grade reading level. And then when you think about medical terminology, that reading level is even higher for some of those medical terms that we use. And locally, many residents in our rural area read at the 4th to 6th grade reading level. So again, this just really demonstrates the need for additional support regarding digital literacy and making sure that our graduate nursing students understand this going into practice and being aware of the reading level of the patient and the families they're working with. So activity 2, students in the graduate patient education and advocacy course analyzed national healthcare websites. So they had a list of websites to choose from, and they analyzed those websites for readability, design. So how user-friendly was it? How was the format of the website? Was it confusing? Was it hard to follow? Was it hard to find information? Layout, cultural sensitivity. So how culturally competent was the information that was provided? And then also the appropriateness for a rural, low health literacy population. So thinking about the patients and the families that are served in our area, does this website represent those patients and families? And is it something that those families can understand? The students used a validated scoring tool to determine the readability, which was the Flesch-Kincaid score, which is shown on the slide, how to actually calculate that reading level. And then the third was that they evaluated those resources for readability. So again, that readability formula, it's based upon the Flesch Reading Ease readability formula. It was originally developed by the U.S. Navy and used by the U.S. Department of Defense. So a score of 9.3, for instance, means that the reading level is about 9th grade reading level. So you can assume that a 9th grader would be able to read that document and understand it. Words can display information about the reading level of the document. So in Microsoft Word now, you can actually look up the reading level of the document, but you can also use this tool, this formula as well. And so the Flesch grade level readability formula. So first, the students had to calculate the average number of words used per sentence, and then calculate the average number of syllables used per word, multiply the average number of words by 0.39, and then add it to the average number of syllables per word multiplied by 11.8, and then subtract 15.59 from the result. So the specific formula is shown on the screen. And so again, if the resulting value is 8.5, then the reading level is assumed to be at the 8th grade level. The Flesch-Kincaid reading age there's an acronym, the FKRA, average sentence length, the acronym is ASL, and then the average number of syllables per word, the acronym is ASW. Students self-selected one website. So there were websites that were provided to the students to select and then do the analysis of that website that we already described. So Wikipedia, Mayo Clinic, WebMD, MedicineNet, the National Institutes of Health topics. These were all the web pages that students were given to analyze for the display, the format, the reading level, cultural sensitivity, all the variables that we asked them to look at. So the grading rubric, so this was used for the course that Tracy mentioned. Some of the questions that were posed to the students were, for what reasons did you choose your web page for analysis? Discuss the content of the web page. Does it exhibit culturally ethnic sensitivity in images and or wording? So do the images represent the population in which is being served? Discuss the layout and the use of white space and images. If the website just includes words and no images, they were to describe that. And then using the 2003 National Assessment of Adult Literacy, what percentage of people lack basic prose literacy skills in Dillon County, South Carolina, the state of South Carolina, and the United States? So again, we really wanted them to better understand that not only is this something that we just need to consider nationally when working with anyone, but particularly in our areas that have even lower reading levels at the 4th or 5th grade level, how are we making sure that the information that are being presented to our patients and families is done in a culturally sensitive, competent, medically accurate, and easy to understand manner. And then students also needed to discuss the meaning of the term lacking basic prose literacy and provide at least 2 specific examples from the website that they chose, and then use the information and resources on the website to support your discussion. So these were the questions that were posed to the students and they had to answer for the assignment. And then also they needed to report the readability of the web page based on that formula they calculated. Does it meet the goal of 5th grade or less? If not, could it be modified to achieve this goal? I know one thing in public health in particular, my background is in reproductive health. It's a challenge, particularly when you're talking about contraception. It's a challenge to get a lot of our kind of documents and web pages and marketing materials at that 5th grade level because of just the terms that are synonymous with contraception and reproductive health. And so there are some times where it's very difficult to modify the information without losing the integrity of the original information. But if there's a way to modify it, we wanted students to think about how could you make this a little bit easier to understand or provide better description or maybe better images so that the patient can better understand what's being displayed to them. So what was your personal professional reaction to the readability of the web page? Would this reading level be a barrier for low literacy patients? And this is where we heard from a lot of the students that they just really overestimated the reading comprehension level of the patients and families and just didn't understand kind of the need that was there. And I think sometimes we take for granted some of the information that's being presented. And when we really look at it, it's being presented at a way higher level than what most folks can kind of easily understand and digest. They also responded to what is your perspective on the importance of educating patients to identify and use reliable and accurate internet sites for use in patient education. They had to include 2 reference sources from within the past 5 years. And then, of course, appropriate APA format, which we love to do, at least in our department. So we make sure that they do everything in APA format with correct layout, citations, references, and grammar. And so our results for the pre and post test, you'll see here the frequencies are displayed. For the pre and post test, we used a Likert scale, strongly disagree to strongly agree. And then there's also demonstrated as the percent change. So some of the items included the statement, I know what health resources are available on the internet. This had a slight increase from 86% to 93%. Our largest increase observed from pre to post were with the 2 statements, I have the skills I need to evaluate the health resources I find on the internet. So we saw a 20% increase from pre to post, that our students feel like they had gained additional skills, increased skills to really be able to evaluate the resources that we're using as kind of supplemental educational resources for our patients and families. And the second statement that showed a very high percent change was, I can tell high quality health resources from low quality health resources. So being able to distinguish between those that are valid and reputable that you would want to share and those that are not valid, that have some misinformation. Maybe they're not culturally sensitive, or maybe the layout is too confusing, or there's too much jargon being used, but they were better able to distinguish between the 2. There was also a 20% increase in the statement, I feel confident in using information from the internet. So to help aid their patients in making better decisions. So just having a greater confidence, 93% of the post felt like they were confident that they could use information from the internet as supplemental information for their patients. We also asked them about how they felt about recommending internet sites to patients. So you'll see the change here from pre to post. One of the larger kind of percentages, we'll see some concerns about recommending internet sites. At pre, it was 55%. At post, it was 29%. We saw there was only a few concerns about recommending internet sites, 23% at pre, and then it increased to 43% at post. So they may have realized actually there's more concerns than what I originally thought now that I've really dived into this and analyzed the website for all of those variables that they looked at. Students were also asked, how do you modify your approach to patient education for patients who have already researched their health issue prior to their appointment? And 90% at post indicated that they would assess the level of knowledge first and then review the material used in patient education. Whereas 10% at post said that they would provide the patient with credible sites and evidence-based guidelines. So we think that that was a positive change, that students understood that the best thing to do is kind of assess where the patient is first and then kind of meet them there and provide information and resources that are kind of in line with what information they're coming with or what information they already have. And so one of the activities they also were asked to do as a part of this was to develop low literacy brochures. And these were done about various different cancers and screening practices for various different cancers. The image shown here was actually part of a skin cancer pamphlet that a student did. They came up with the images, they came up with the layout, and they had to do the reading level to make sure they were developed at a 5th grade reading level. And we actually had these printed on campus, and then we were able to distribute them to some of our local federally qualified health centers, our free medical clinics, and some of our other community partners. So it was a great collaboration between using something that students learned in class to then developing their own materials and then being able to share that with our local health partners and community partners. So the brochure learning activity, they also had some items around their participation with this. And so we looked at the mean score. We used another Likert scale from 1 to 4. And you'll see here that the average level of agreement among all the statements was 3.4. So the average, when we took an average of all of them, so it was corresponding with agree. But you'll see some of the items that were asked were, I can define health literacy. Low health literacy can lead to poor health outcomes. I understand the health outcomes that result from low health literacy. When writing educational materials, I try to keep the reading level at a 5th grade level or lower. And so all of these were very positive in terms of seeing that the intervention and the project that we implemented through the course had a positive effect on our students, and one in which that will now be applied in the real world setting when they're working with patients and families. Our student participants were mostly female, 93%, and about 80% were white or Caucasian, and over half, 64%, were between the ages of 26 and 35. And that's pretty representative of our nursing program. I mean, our nursing program is mostly female. And so that kind of population of our graduate program and the participants was very representative of our nursing program as a whole. Students reported the highest average level of agreement with the statement, I know why health literacy is a problem in healthcare, and that was a mean level of agreement at 3.79, which corresponded with strongly agree. And the lowest level of agreement was reported with the statement, patients remember most of what healthcare providers tell them. And so that level of agreement was 1.93, which corresponded with disagree. And as a patient, I think all of us can say that that's probably true from time to time, that we do not always remember what our health providers tell us. So I think that was expected. And the qualitative feedback that we gathered from that brochure learning development, what did you learn from developing the brochure? One student indicated, I learned how important it is to make sure that the information given to patients is written in a way that they can understand. I learned how important the why and how of devoting educational materials is for our patients, and like why we're doing this, and about the specific information that was most difficult to write at a fifth grade reading level. And many of the responses included how to describe medical terminology. How do we revise medical jargon in a way and explain in a way that our patients and families understand what we're talking about, and it's still accurate and comprehensive. So the definitions of medical diseases was difficult to write at a fifth grade level. Certain health conditions were hard to write at a fifth grade level. And I just, I think this is something that we should all kind of do. I would encourage everyone, like when you're looking at any material, think to yourself, is this at a fifth grade level? Most of the healthcare material is not. It's way above it. So it's very difficult to do, as our students pointed out. How will the information you learned about health literacy impact you as a provider? And one student said, it's something that I'll carry with me throughout their future practice, as they'll be able to provide health education at lower literacy levels, allows me to better serve the patient load that I'll experience. And one student indicated it would help them remember that not everyone understands the terminology that we use. And so again, just taking into account, I know often in public health, we use acronyms for everything. And even something like that, where when you're talking to a patient and families, making sure our students understand that they don't know what those acronyms mean. So you have to define what those are and explain things in a way that they're going to be able to easily understand. So in conclusion, the impact of low health literacy on patient outcomes is huge. The research has shown that. We know it's a key part of health literacy, and healthcare students must have the necessary tools and knowledge to assess and support health literacy in patients. We know that digital resources are becoming the standard. And so how can we make sure that our patients, particularly our older patients, as Tracy mentioned, are able to understand and access digital resources? And if they can't, or if they're unable to, what options do we have so that they still get that information in a way that they can understand? Curricular activities should support this knowledge and skills in digital health literacy. I'm actually replicating this in kind of a smaller scale with my undergraduate students in a public health course. So it'll be interesting to see if their responses and perceptions are similar to the graduate students, or if they're a little bit different, given that they're in undergrad and had kind of less experience. But I think this is something that was very easy to do. We were able to incorporate it into our curricula. We had the brochures printed on campus. And so this is something that I think anyone could replicate at any sort of educational institution or community-based organization where you work with people, just as an activity to kind of shine some light on how difficult it is to write materials at a fifth grade level and better understand how to translate information to the people that you serve. So that concludes our presentation. Does anyone have any questions? We appreciate everyone listening in.
Yes, definitely. And the other thing I was going to mention, if you're looking for like a service learning activity, if you reach out to organizations, they may be interested in your students doing this as well. One of our federally qualified health centers had some specific topics related to hypertension and diabetes. And this past fall, I had the students to create brochures, and that the clinic actually had them printed out for patient use. And so it's a great way to demonstrate service learning, which is important for our students and for accreditation. So,
Well, you really pointed out a couple things. Surprisingly, there's a desperate need for improving health literacy. And it really, people need to get it in terms of, I think, something printed they can take with them and read. The challenge is how do we educate people before they have a health problem? That's a tougher task, isn't it?
and this isn't digital, but we had a patient this week who was unable to read or write completely, had completed the 8th grade and dropped out. And so she was needing a medication change, and I went over it with her, and she was starting a new medication. And I made sure to tell her to keep taking her same medication. And anyway, the other provider I was working with, I said, I know that because of her educational level, she may have difficulty. That's why I went the extra step. She actually called back the next day and, she's unable to read or write and thought we had only sent her a week's worth of medication. So it's things like that that really drive home the importance of communicating at a lower level with patients. And, we think that they understand, but sometimes they don't. So,
And I think one of the strategies that we've seen is, just asking patients to kind of repeat what they
right, the
heard
teach back.
so that
Yeah,
you can
absolutely.
confirm or verify to say, this is after you say what you need, kind of, okay, let me know what you heard and let me know, what you understood, just to kind of see if there's a gap in between what was said and what was actually understood.
Yeah,
And it's hard for people, when they're in a stressful situation, it's even more difficult to understand what they're being
absolutely.
told, having,
Absolutely.
uh,
Yeah.
We're in a new environment. Yeah. So I love the area of health literacy. It's so important and sometimes neglected. But thank y'all so much for listening to our presentation today.
yeah. It's a struggle. How do we educate people before they need to apply that information? That's the real challenge.
Mm-hmm.
You come up with an idea how to do that. But
If anyone
having
can
a
come up with an
student,
idea, it's Tracy. We'll put Tracy on it.
having having students evaluate websites, make sure they're at the appropriate reading level. I mean, that is a positive step that will impact a wide number of people. It won't get them all, but it's something. And you're right. You get people writing these, they know the information. They don't look at it from the perspective of who will be trying to intake the information.
Right.
Anyway, unless
Well,
Kimberly or Bammy have a question.
thank y'all so much. I hope y'all have a happy Valentine's Day and a happy Friday and a great weekend.
Thank you, Tracy and Sarah. Appreciate you
Thank
doing
you,
this
Bob.
for us.
Thank you for the opportunity.
Thank you. Thank you so much.